In a different video, we talked about discogenic instability, and we demonstrated 3 Swiss ball supported stretching procedures. One for lumbar backward bending, one for lumbar side bending, and also a Swiss ball supported lumbar flexion stretch, which supported the patient's lumbar spine through their abdomen and constrained the total amount of flexion occurring in the lumbar region. We now want to give you an additional option. And again, this is an option that you are likely going to prescribe for your lumbar patients who are demonstrating to you signs and symptoms consistent with lumbar stenosis. In other words, they're starting to get their backache more often in a standing position. They're starting to get their backache or maybe their buttock and leg pain when they're walking more. They're becoming less tolerant of lordosis. So we need to protect their lumbar spine, give them support from the front, which we're going to do with a table or at home, a bed, or maybe a countertop, okay? And then we'll allow the weight of our legs to drag our pelvis into a posterior rotation, posterior tilt, okay? And that will reduce lordosis and take compressive load off of the posterior third of the various lumbar motion segments. Remember, flexion opens up the central spinal canal and is one of the most important stretches for our patients with lumbar spinal stenosis. So here's how it looks. You have the patient come up to the edge of their bed or the edge of a sturdy table or countertop, and we start the exercise by spreading the feet out. Then we soften or flex the knees, and we start to bring our abdomen down to the edge of that table, countertop, or bed. And this helps to give support to the lumbar region. Now we make sure our patient's neck is in a good position. So I'm going to bring my forehead to my forearm so that my neck stays in a nice elongated mid position. And now notice what I do with my legs. At this point, I'm going to go from the balls of my feet to sort of my toenails. And that really allows my legs to relax, and it allows the weight of my legs to pull my pelvis into a posterior pelvic tilt. Again, that reduces the lumbar lordosis, opens the central spinal canal, and takes load, compressive load, off the posterior third of the motion segment. So here's our stretching position. And this is a treat to effect exercise. We have our patient get up carefully, using their legs and their hands at the same time. Okay? And what I mean by treat to effect is, if your patient's having backache or pain referral into their lower extremities due to lumbar stenosis, they get into this position just like over the Swiss ball, okay? And they're in this position until those symptoms improve.